One of Romneycare in Massachusetts, you're going to have a hard time finding a difference between Obamacare and Romneycare. I mean, that's just the facts, and there's no way around it.
Now think about what that means going up against Barack Obama, who you're going to claim, well, top-down government-run medicine at the federal level doesn't work and we should repeal it. And he's going to say, wait a minute, Governor. You just said that top-down government-run medicine in Massachusetts works well.
Romneycare, given what's happening in Massachusetts, isn't a lot different from Obamacare. And so he's going to have to deal with that constantly, I believe, throughout the race.
Joining us now is E.J. Dionne, Washington Post columnist and MSNBC contributor, Brookings Institution senior fellow, and the author of Our Divided Political Heart, which is just out and which is great. E.J., thanks for being here. It's great to see you.
Good to be with you. You started the draft Fred Thompson movement tonight. It's going to sweep the Republican convention.
You know, I still have a Fred Thompson-related website URL left over from an earlier campaign. So if it does happen, I'm going to be the one who benefits. Let me ask you, though, looking at all those Republican Romney rivals playing pundit, talking about his Achilles heel for a general election against Barack Obama. Obviously, they were all making the case for themselves instead of him at the time they were making those arguments. But were they right in those arguments?
I think they were right. I thought they were right at the time. You know, it was fun to pick up the Wall Street Journal this morning and read that editorial. It reminded me of one of the greatest lines in politics. In 1960, the Wall Street Journal criticized Richard Nixon, and John Kennedy said that was a little like having the Osservatore Romano, the Vatican newspaper, criticize the Pope. I mean, that is not supposed to happen in Republican politics, and I think the Journal was reflecting a very widespread view. You can't be in a position of saying it's a tax when he does it, but it's not a tax when I do it. And also, you can't put yourself in a position where you've got an Etch-a-Sketch on steroids, where only a few days earlier, your campaign, speaking for you, says, no, this is not a tax, and then you back away. And the last thing is, I think it shows that he will always respond to pressure from the right end of his party or from the congressional leadership. And I think underlying this, that's going to be the issue that the Obama folks are going to play down the road.
E.J., one of the things that you have written about and that you in your book, but also you write about eloquently in your column at the Washington Post, is the idea of how policy connects to politics, how we talk about lawmaking and the use of government, which, after all, is what elected officials are working on when we send them to Washington to work on our behalf. Do you think that the Romney campaign handling this so poorly, this issue of health reform just getting so bungled on it, actually opens an opportunity for the Democrats to reconsider whether maybe they want to run on health reform? Everybody keeps telling us, no, they want to sort of pocket this victory from the Supreme Court and move on. They don't want to talk about health reform a lot. We saw today on the stump, though, President Obama being approached by a woman in tears, thanking him for having passed the bill. We see the Romney campaign having no way to explain Mr. Romney's previous public service connections on this issue. Should they be running on health reform? Is there an advantage to press here?
Well, I think they should be proud of what they did, and finally they have a chance to explain it. And when you hear politicians on the stump defend particular things this bill does, whether it's letting people's kids stay on the parents' health plan, or you can't be discriminated against because of pre-existing conditions, or repeal Obamacare would restore the donut hole to the prescription drug benefit, seniors would be very angry about that. So, yeah, I think there's always been an opportunity to run on this health care law. And I think with Romney being in such a difficult position to defend its repeal, given that he endorsed something a whole lot like it, they ought to take advantage of it.
E.J. Dionne, MSNBC contributor, columnist for the Washington Post, and author of Our Divided Political Heart. E.J., thank you very much for being here. I really appreciate it.
Always good to be with you. Thanks.
I will say that on the issue of the Democrats campaigning on health reform or not, I do think we're seeing one of those things where when White House and campaign sources are talking about what they are doing, they are downplaying the idea that they will run on health reform, that the president will run on health reform. But when you actually watch the president's remarks and even the vice president's remarks when they're out on the stump and they're actually campaigning, they're talking about it more than they say they are. They're sort of spinning the beltway away from what they're actually doing, because when they talk about health reform on the stump, boy, do they get a positive crowd reaction. It'll be interesting to see if the spin follows the actions of the politicians in this case. All right, tonight, a special rock star edition of The Interview, seriously. And we've got some really good news from Austin, Texas, and from Portsmouth, New Hampshire to bring you tonight, exclusively, and lots more besides. And I promise that we are done for the night playing this sound effect. That's it. We are done with that. If you do not believe me, go to FredThompsonisinherentlyfunny.com. I just said we weren't going to play it again.